Welcome to the Living Spiritfully podcast, the Mind Body Misfits edition. Here are your hosts for today, Paul Galloro and Claudia Micco.
We're back together again for the first time, and we are the Mind Body Misfits. Oh, you know, it only works when we're in the same room that we get it right. Yeah. How are you?
Fine. I miss you, and I
know
Canada.
Listen, we miss you. Canada misses you. Dominic misses you. I miss you. Actually, I was talking to Dominic today, and I was like, "Oh, I'm going to talk to Auntie Claudia." And he was looking, and his ears were kind of going up, and then at one point he looked out into the other room, and I'm like, "No, she's not here. She's going to be on the TV."
Oh,
so we miss you tremendously.
That long walk.
Oh, remember that?
Yeah,
it was good times.
Well, it's so good to see you.
It's so great to see you. Now, I am looking forward to our conversation today because in typical Mind Body Misfits fashion, we're doing something completely different. And we're talking about things that people are not talking about. It might be a little bit more serious than of a topic that we've talked about in a while. And also, we're the Mind Body Misfits, so how serious can it be? But you brought forward a very interesting topic that we're going to discuss.
So today we're going to discuss a topic called lipedema, which is the disease they call fat. The disease they call fat. And a lot of our clients and a lot of people out there who are not clients, who are enthusiasts, may have this and not know it. And it's the type of fat that's diet and exercise resistant. So for example, if you're one of those women, because it affects mostly women, that has tried their whole life to lose a certain amount of weight that's usually below the waist or in the upper arms, and no matter how much dieting and exercise you do, it will not go away. And that is a chronic and progressive condition that affects the distribution of fat cells in the body, which causes an abnormal accumulation of fat in the arms and legs.
Yes. Now, because you introduced me to this subject, a year ago, maybe. And I remember even before that you talking about it, but we only didn't really start talking about it a little bit more. And it's still relatively unknown. But while I was doing some research, I read somewhere that 1 in 9 women will have this condition. Now, I'm just going to read something from an article that I read, just to kind of, I mean, you already described it, but just to give people a little like specific thing here. Lipedema, and there are different variations of the spelling of this, but lipedema is a chronic condition that causes an abnormal accumulation of painful adipose tissue, which is fat, in specific areas of the body, typically the legs. This condition is frequently accompanied by obesity and psychological vulnerability or distress, and less frequently by fluid swelling, commonly, and again, inaccurately, referred to as lipolymphedema. In reality, sufferers of lipedema are actually a heterogeneous group of individuals dealing with lipedema plus or minus the related conditions of obesity and lymphedema. Now, I just have to say, like, the lipedema, lymphedema, like when there's too many of these technical words, it does my head in. But you're here to describe or to kind of distill it for us so that we can understand it better, because this is a chronic thing that it's affecting a lot of people, and it's putting a lot of unnecessary psychological stress on a lot of women and some men that are I'm going to use the word suffering, that are suffering from this.
Oh, totally suffering. So let's just go with the first part. The word lip, which would be usually describing fat, lipids, right? And sometimes it gets, if you read about it, people may get confused with like cholesterol, right? Or triglycerides. But this is specifically for fat on the body, not in the bloodstream. Lip and edema means swelling. So it's that painful swelling. Lymph edema is the lymph nodes which are swollen due to usually inflammation and increased activity at that area without being able to get pumped back to the body. And the way that you can differentiate as a person who might have it, or someone, maybe one of your client has it, is usually lipedema is the same on both sides of the body, where lymphedema typically may be one leg or the other, or one side of the body or the other. And then there are some signs. You can do a pinch test on the toes or the fingers, and if you can pinch the finger or the second toe or the big toe, it's usually lipedema. And if you can't pinch it, then it's usually lymphedema, or there's pitting. Pitting is when you press on it and the indentation stays. And so if you don't have pitting, meaning if somebody presses into it, your doctor presses into it, and it doesn't stay, then it would be more likely lipedema, whereas lymphedema, there would be more pitting.
Right. And so we're talking about lipedema today, the accumulation of painful fat, and generally it's in the lower extremities, so from the hip bones down, but sometimes can also appear in the back of the arms. Yeah. So here's the thing, and we'll talk about this a little bit more. It is the reason why it gets so confusing is because over time, as this progresses, it does affect the lymphatic system. So then you have that lipolymphedema. Right.
Yeah.
Right. And but so I mean, okay, you'll tell us a little bit more about this, because then we also want to talk about how this is like, I don't want to say harming, but it's hurting a lot of people because they're kind of being misdiagnosed. Because actually one of the articles that you had sent me about a woman, she didn't know what this was. She just thought that all the exercising and all the dieting that she was doing, because her legs weren't changing, she thought there was something wrong with her. And that's why we want to talk about this, because this is a condition that doesn't matter the amount of diet or exercise that you do, it's not going to, it just doesn't work to alleviate this lipedema. Doesn't go away through diet and exercise.
Yeah. So the fat cells, we would call them diseased fat cells. So they are diet and exercise resistant, and if you look at somebody, they may have the appearance of cankles, for example. Remember the word cankles, where the fat is kind of rolling over the ankle. That can also be lymphedema, but for the most part, it would be lipedema. But typically, you'll see it in different stages. So, for example, stage 1. Body looks pretty normal. Maybe there's more of a pear-shaped, bigger hips type person. Then stage 2, there starts to be more indentations and a sponginess. And then stage 3, these fat cells are continuing to grow regardless of the amount of diet or exercise the person's doing. They may be really lean in the upper neck and chest, but there seems to be kind of more growing outward. And then the fourth stage is when it keeps growing, and then the lymphatic system becomes more affected by it. So there are different stages to it.
I'm going to put a photo on the screen for those of you that are watching this on the YouTube, or if you're seeing this on Spotify in video form. I have a picture on the screen that breaks down those 4 stages that Claudia just mentioned.
So as you can see, that first picture looks like a normal, right? Looks like a normal leg, maybe just a little bit heavier. This is where a lot of women start, maybe at puberty. So whenever there's a change in hormone levels, this is usually when they'll start to notice this little bit of a change. Maybe it looks like cellulite, and you think, oh, I can just get rid of this by dieting or exercising. And you can maintain it, but you can't always change it. Then stage 2, you'll start to see how that in that picture, how it's starting to sag a little bit, because it also affects the skin texture. And at this point, the person may touch their own body and feel what may be like grains of sand, right? And so if you're touching, so if you were someone who thinks you may have this, you would want to like palpate your own leg or your calf or wherever you think you have it in your arm, and it may feel like grains of sand. And then what happens is that develops into what feels like small balls of, let's say like a little bean, or something like a rolling ball. And then as it gets bigger, those lumps get also bigger, and they'll feel more lumpy. So it's that lumpiness that you want to look for. So it starts off as like just a little like grains of sand, and then progresses into bigger things. And it's diseased fat, so we can't get rid of it. So by stage 4, you're looking at the lymphatic system being affected in this picture, because it's hard to get that circulation to go back up. And at stage 4, there's limited range of motion, even though most people with lipedema are hypermobile. So if you're someone who's hypermobile, there's a good chance, and you're overweight, you're very flexible. At stage 1 and stage 2, you may be, the best at yoga, because your connective tissue is also affected by this as well.
Right. Now, one of the things, and I'm sure our viewers looking at the photo, one of the things that came up in my study is that it affects just the legs, so it doesn't go on into the feet, as you can see in these photos, at the ankles, especially in stage 4. As you can see, the feet haven't changed. It's not like the feet are getting larger or swelling as much. It literally just looks like it's a pair of pants that end at the ankle, right?
Exactly. And that's why the doctor would do this test, that little Stemmer's test, to see if it pinches or not.
Right.
And and again, you're going to look at your clients, or if you have this, you're going to look at yourself. And if you see that you have this pear-shaped body with a little bit of excess, and you can see it in my arms, a little extra fat, no matter how much you could do all the tricep exercises in the world, you're going to feel fat here. So a lot of people in my family have this, and I didn't really know, I didn't understand it. My one cousin had always, since she was a child, just huge. A lot of people in my family are very big, and no amount of exercise, even having the stomach, that surgery where you get your stomach shortened so that you don't die.
The gastric bypass, you talking?
Gastric bypass. I have a cousin who had gastric bypass, and while yes, she did lose some weight, it was not to the level that you would think. So what ends up happening with women who get this or have this is they, first of all, don't know. Psychologically, they get very depressed. It causes anxiety, and usually an eating disorder of some sort. Because no matter how much you change your diet, and I have clients right now who also have this, and one in particular, perfect eating, all that stuff, it's just impossible to lose that tissue. What has been helping has been having her on metformin and Ozempic, which is giving her a little bit of relief, but very slowly. And just coming to the realization that your body is not going to be, no matter how much you exercise, you're not going to have those soft, lean legs that are muscular like other women have.
Right.
So it can be very depressing.
Absolutely. And especially when you don't know what's happening and you're trying all the things that the media is telling you to do, or that, the industry is telling you to do, and it's not changing.
Right.
Some of the things that I was reading as well, like So it's not obesity, but it can lead to obesity and the issues that come from obesity because of just not knowing how to deal with this condition.
Exactly.
And then all the
There,
psychological stuff that comes with it that can then lead to less movement and poor food choices, etc.
exactly. So like chronic depression,
Yeah, yeah,
um, very, very common with lipidemia or lipedema, again, depending on how you say it.
yeah.
Now, it doesn't mean that you don't want to have a healthy lifestyle,
Right,
because basically what my goal is to catch women, and it's about, I think it's 11% of all women have this. And that's a big number, actually. What I'm trying to do is I'm trying to catch them when they're at stage 1 or stage 2, so that you can at least try and slow down that progression. Because there are some things you can do, like the anti-inflammatory diet, because this is an inflammatory response and perhaps an immune disorder. So again, this lack of knowledge, lack of research, just throwing them into a category of you're just fat, you're obese, causes a lot of problems. Then they have the bariatric surgery, and of course that doesn't seem to work, and then they feel guilty. So I'm trying to catch them early so that they can at least ward off getting to that stage 3 or stage 4 condition. Doesn't mean they may not get there, but having an active lifestyle, an anti-inflammatory diet, keto diet seems to work really well for it, and an RAD diet, rare adipose disorder diet, seems to help this also.
interesting.
So despite the lack of knowledge, the existing guidelines for lipedema treatment are healthy lifestyle, weight control, physical activity, obviously. But what really works for this, which I know a lot from some of my groups, is vibration training.
Oh,
Yeah, vibration training.
interesting.
Yeah, like on a vibration trainer. What doesn't work well are things like running. It's too much impact, because the pain. So there's pain involved in the legs. Someone who's, for example, someone who stands up all day will likely have swollen legs by the end of the day because of this. And that's where we start getting into that lymphatic problem. And that's why they're
Right,
so interconnected. Right.
right.
So,
Yeah,
so different exercise, obviously weight training helps, but what they're saying is not too heavy weight training, but obviously to fatigue, but not like, powerlifting or anything that's going to cause too much stress on the joints.
right.
And then
Okay.
walking, of course, HIIT training can be helpful as long as there's not too much jumping. It seems to be that jumping is one of the things that's not so great, but rebounding is good also.
Oh, I
And,
was
and of course, water exercise is probably one of the best things besides vibration training.
interesting.
Mhm.
Something that I also read was that it does affect the connective tissue within the joints, especially.
Yes,
So that makes sense where the impact things wouldn't feel so good, though rebounding could be very beneficial, especially for the lymph movement that you get from rebounding.
exactly. And because they don't know too much about it, it's really hard to say at this point, but as they're doing more research, and I see online very often when I'm going into my groups that they are starting to have more research studies, because they have to do the studies first before they can. But what we do know, it's typically inherited. It's a family thing, definitely related to hormones, whereas the changes are more pronounced during puberty, pregnancy, and menopause.
Right.
So those 3 times in a woman's life, you'll really see this kind of change. And basically, that's what you're looking at, is you're looking at this odd fat that you can't get rid of with no amount of exercise or diet. You're looking at what your family history is, right? Hormonal factors.
Okay. So, I mean, we've talked about, it doesn't really, I mean, it comes from somewhere, but it's mostly hereditary. There's stuff that we can do to help um, slow down the progress, but it's not something that can be reversed. At least we
So
haven't
I want
found
to
that
get
yet.
people to that's why we want to catch our clients at stage 1 or stage 2
Okay.
before it gets to be to the point, because even though they may be hypermobile, once your body is that big, it's very
It's hard to
difficult to move
move.
around. Right.
Right.
So
Right.
again, it's a catch 22.
Yeah.
So that's why we're trying to really get people aware of this, so that as a young girl, for example, to avoid having an eating disorder, which is usually in our teens, especially for women, and I can attest to this, having taken, black beauties and speed. Before I learned about exercise, I would starve myself and take speed. Basically, it was low grade speed back then,
Right.
or Dexatrim or
Yeah.
anything to keep to try and get the fat out. And I very vividly remember when I was going through puberty, looking at my ass in the back of the mirror in our bathroom with a hand mirror, and seeing a lot of dimply fat on my ass as a young teenager when I was going through puberty, and thinking that I was fat.
Mm.
And of course, I'm not fat, I'm actually quite lean, but there's a possibility that I may have inherited this also because of what I see in my own family. Now, I have always exercised, I've probably been able to manage it, but I have noticed that grainy, sandy, lumpy, small bulk areas in my arm, which my mother has just outwardly all over her arms, thin everywhere else, outwardly in the arms. So it could
Right.
just be somebody's arms. But we want to avoid them getting an eating disorder at a young age, or being a chronic over-exerciser, or what they call like exercise bulimia, for example.
Right. Yeah. Yeah.
So I'm trying to catch them younger.
So, okay, I mean, as we know that there's not, I mean, we want to catch it early, but there's also not a whole lot that we can do. But as Mind Body Misfits, we also know that thought creates form on some level.
Right.
And it's important that we keep our mind right so that we can keep our body right, so to speak. So what do you recommend for someone that is experiencing this? What's a mindset that we need to stay in for someone that is experiencing this?
Good question. Well, something cognitive, like starting off with cognitive behavior or cognitive behavioral therapy, something where you're really looking at your moment to moment thought patterns.
Mm.
So when you notice yourself comparing yourself to another person, well, her legs look like this, mine should look like this. I do all this exercise and nothing is changing. Those kind of thoughts that come into people's mind. Cognitive behavioral therapy is a big help for the thoughts,
Right.
to reframe them. So that's what we want to do, is something cognitive.
Okay. Can you give an example of of an exercise, or and when I say exercise, like a CBT exercise, or a thought, even like an affirmation or a sequence or a statement?
Um, well, it's again with cognitive behavioral work, it's in the moment. So let's say you are, just like what I said, as soon as you notice, it becomes a noticing thing before
Right.
the spiral downward. So let's say you're at the gym. Let's say you have this and you're at the gym, and then you see yourself comparing yourself or starting to get frustrated. You'll take that thought and you'll turn it around. I'm doing the best that I possibly can, and my body is healthy and strong. And then you start to affirm all of these things that I can do, or that we can do. So I can ride the Stairmaster for a half hour. I can lift 50 pounds. I don't get winded going up and down the stairs. So instead of letting yourself get into that negative thinking, right? I mean, it's okay to look at it because that's what cognitive behavioral therapy does. It forces you to look at both ends of the coin, both ends of the stick, right? So you have to look at both ends and then look to the end of the stick and then make those, say, affirmations, but make a list of those things that are positive, that you really appreciate about your body.
Right.
Rather than the negative stuff.
So it's looking for the evidence and like finding the proof of how strong you are, how healthy you are, etc.
Yes, exactly.
Yes. Okay.
And then in addition to that, without being like, well, there's nothing I can do about this. What can I do? Okay, so I can check into keto diet. I can do anti-inflammatory diets. I can do manual lymphatic drainage therapy.
I was just going to ask about that.
Compression therapy, right? Those type of things will also help with the pain that comes along with this and the swelling. Because let's say you have a client like this and you don't know anything about this disease. And you've had this client for 3 years and nothing is changing. Like their upper body's changing. They've got biceps, they've got beautiful delts, pecs, abs even, but everything from the waist down is a no-go. Or getting bigger. That's the kind of person that will go into the spiral. So we want to offer solutions to them, not just the physical stuff like the diet and the exercise, but also those mental solutions, those cognitive solutions. So we wanted to really get this kind of in a full circle. So it's not just, do all these things and then forget about it. It's, I got to use my mind to get me out of this. And then again, like you said, find the proof. Right? What do I do? What am I doing that's working? And I feel really good after exercise, regardless of if my body stays big. It's okay to have a big body. All big bodies are beautiful. All small bodies are beautiful.
All bodies are beautiful.
If you have a body, especially if it's working, you're very lucky.
Yes.
And I think that we don't go to that level with our clients. We tend to keep giving them harder exercises. And for these people, those harder exercises will cause them to be very tired, to be very swollen the next day, or even have bruising on their body that they are like, where the hell did this bruise come from?
Right.
That's another factor is bruising that it's like, where did this bruise come from? And it's because of the connective tissue.
Right. Wow. This truly, I mean, I remember seeing like some, like examples of stage 3, stage 4 in a fit person. And like you said, upper body looks a certain way, but lower body looks completely different. And now like knowing all of this stuff, I see it in my mind and it makes sense. And then also I think of all of the people that have suffered with this for so long. And the thing that really where I really want to kind of step in and do what I can is the mindset stuff, right? Because at the end of the day, this is a condition and it's just like, any other condition. Well, it's not just like any other condition, but similar to the idea that when you have a condition, you have to learn how to manage it and you have to learn how to live with it. That's what we got to do here. But it all starts at the way we see ourselves. Our perception is reality. So the way we see ourselves, the way we see the situation, and what our thoughts are around all of this. And also know that sometimes our thoughts can be not so in a good place, and we need some help getting to that place where a professional may be able to support us in working through the psychological stuff that comes up with this, because it's not just the body we have to keep in mind, it's the entire being.
Right. And if you are someone who has a trainer, if you're not a trainer and you're watching this or listening to this, if you have a trainer who keeps pushing you and keeps changing your diet and keeps giving you harder things to do, or more of this and more of that, and you're not seeing changes, you'll want to maybe discuss this with your trainer and say, hey, I know about this. What do you think? And the reason I say this is because a while back, especially when I was really like, okay, I really see this as a thing. I see it in my family. I can feel it in my own arms, even though I'm very lean. I know that in my upper arm, just like my mom, I know that this is a possibility. I consulted with a few very high level nutritionists and people who are researchers in the industry who are friends of mine, and I'm not going to say their name, but I sent them a bunch of research too, and they literally said, I have never heard of this. And I'm talking about people who do nutrition counseling for a living. They had no idea. And doctors, most of the doctors don't know about it. And this is what is also going to be an issue when someone goes to their regular general practitioner and says, hey, I think I have this thing I can't lose. Is there someone you can refer me to? Most of the time, they've never heard of this. They're going to think it's a lymphatic problem, and they're just going to tell you you're fat and you need to go on a diet.
Right.
And that won't be the case.
No.
They will need to see a specialist. And then the way that they can, so let's say they are at that stage 3 or even at stage 2 or stage 4, but at a stage where they're like, there's nothing else I can do. I need to get some intervention here. You have to go to a very specialized doctor who performs liposuction specifically for this type of fat. And there's a lot of people who went to that I've talked to who've gone to the wrong doctor to get their liposuction and ended up with it coming out worse. Ugh. So there's and there are very few of these doctors around. So you have to research it really well to find the right doctor who can do the lipedema treatment, pull out the fat. The fat won't come back. But if they don't get the right one, they're going to end up with a lot of lumps that end up being worse than what they originally had. So that's an important thing as well to try and get. But before somebody goes in for liposuction, they should definitely try to get on anti-inflammatory diet, exercise, obviously, do mindset and body appreciation work. And then if they can, they could get on diosmin, DIOSIM, which is an anti-inflammatory, butcher's broom, aspirin. There are some anti-inflammatories that seem to help a little bit. So that's the advice that I tend to give people, and to try and just stay really positive and loving, having a real loving regard towards yourself.
Right. And thank you for that, because it came up in my reading, in my research somewhere. This is an autoimmune condition, right? And so
perhaps, yes, most likely.
So if it is an autoimmune condition, that when we look at the the metaphysical meaning behind any kind of autoimmune thing, is that self-love. It's directing love toward our body. So going back into what you were saying, words of appreciation, words of gratitude, blessing ourselves with love. Look at the things that my body can do. I celebrate my strength in doing this, or I celebrate my endurance in doing that, is a way that can help kind of reframe this. And also knowing that this is a condition that needs some sort of, we need to be aware of it, and we need to figure out how we can best manage it in our lives.
Exactly. And if you're a trainer, for your clients. and
Right.
keep them from overtraining
Yes.
and all getting too caught up in having an eating disorder.
Right. Because you know what? Hey, we're just going to say this. Sometimes trainers, we can do it. It can happen, right? Where we don't really fully know. We think it's something, but it's something else. We say it's one thing. The way our clients listen to us and look up to us, we have to be very careful with our words and how we speak about certain things. And especially with this one, because there's information out there, but it's so little and it's not completely understood. So we need to make sure that A, we know what we can, and B, we're deferring to a professional that has a deeper understanding of this.
Exactly. So just to summarize, lipedema is a fat disorder. It's an accumulation of subcutaneous adipose or fat tissue, particularly in the upper arms and the legs, and it predominantly affects women, about 11% of the population, or one in 9, as you said. There's some statistics, but many, maybe more than we even know. It also contributes to other pathologies like obesity, inflammatory diseases, neurological disorders, depression. It can be very painful, and when it gets to later stages, impair someone's mobility. It also increases the risk of eating disorders, depression, anxiety, like I said. And it seems like exercise, diet, and surgery seem to be the best things, as well as lymphatic drainage, massage, and anti-inflammatory diet and supplements.
Okay. All right. Wow. Well, thank you for enlightening us with this, because I'm sure there are people out there that it has expanded their minds, opened their hearts a little bit. And it's my hope, and I'm sure it's yours as well, that just getting the word out, bringing awareness to it is going to help support so many people in finding somebody that can guide them through this and get the support that they need.
Excellent. Yes.
Yeah.
And they can always DM me for private work. This is what I do. And because I do the mind work with people.
Yes.
Not just the body work.
Yeah. Which I was just going to mention, so I'm glad that you brought that up. Listeners, if you're listening to this on the Spotify, if you go to the page where you found this episode, scroll down, it'll say something like, tell us what you think of this episode. Send us a message through that. Let us know if this is something that you've experienced, or maybe it's a aha moment. You can also find Claudia's contact info in the show's notes, how you can get in touch with her on the Instagram or through her website, so that if you have any questions, get in touch with Claudia. And Claudia,
definitely ask me, and I can refer as well to get you into the right doctor if that's what you need, or the right trainer where you live.
Yeah.
If you don't want to do online work.
Definitely.
Thank you so much, Paul.
Well, thank you, Claudia, for today. Honestly, thank you for enlightening us with this information. I'm sure it's going to help so many people. So listeners, check out the show's notes, how you can get in touch with either myself or Claudia. And also remember to join the Living Spiritfully Collective by going to livingspiritfully.com. And Claudia Micco, I love you so much. I can't wait to see you again next time. We'll be together again. It's October now, so we'll be together again next month. And P.S., it's Canada, obviously. I'm in Canada. You love Canada. And it's our Thanksgiving that's coming up soon. So
happy Thanksgiving.
Thank you. I just want to say thank you for being in my life. Thank you for being a Mind Body Misfit with me. And on behalf of all the listeners, thank you for being a regular co-host of our podcast. I love you so much. I love everything that you bring. Do you want to take us home?
Why fit in when you were born to stand out?
Love you all. We'll see you next time.
Bye.
The Living Spiritfully podcast is a Spiritful production. Executive producer, Paul Galloro. Co-producers, Claudia Micco and Catherine Stilo. A big thank you and much love to you, the Living Spiritfully community, for liking, subscribing, sharing, and supporting this podcast.
Can we
What?
stop recording for a second?
Yeah.
I gotta pee.
Oh God. Okay. You know what? I'm leaving this in.